This is a Christmas period, and people will be moving from one point to the other. I'm asking and pleading with our drivers, please drive safely. Injuries can occur, but where we can prevent, it is important that we drive safely on our roads to avoid accidents that are going to cause miseries in our households. I want to urge each one of you to equally take this time to have screening at the community level. Our community health promoters are on it. Our community health promoters will be able to take your blood pressure. They'll be able to check your blood sugar. They are going to be able to even remind the women and the teenage mothers who are in the houses to go for their prenatal and antenatal clinic, and equally postnatal clinic. And during delivery, remember, SHA is taking care of our mothers, and we are going to be able to have safe deliveries in our hospitals in a space where our mothers are equally covered. Again, I'm talking about the young people who are at home right now. It's during the holiday. We saw the other day during the World AIDS Celebration Day, HIV and AIDS is still very rampant in our communities, and it is important to note that even teens and children, any person can get HIV. It would be important that we take charge and take care of ourselves during these festive seasons. We have Jamii Imara Mashinani Forum, and this forum basically is a group of people who work in the executives, the implementers of policies in government, starting from CSs, PSs, directors of boards, the chairs of boards and CEOs of boards and other senior executives. It would be important that we have citizen engagement, and that is what we have been able to do. We are engaging the citizens on the ground. If it is an issue to do with health matters, I'm able to answer the citizens while I am on the ground, face to face. And it would be important for the citizens to ask as many questions as possible, because communication is the cure to any misunderstanding. And we have said it is time that we go out there and communicate to the masses what the government of the day is doing. Because the government is doing a lot, from housing to agriculture to health. There is a lot that is happening, and the common mwananchi is demanding for just that information. Therefore, we are taking lead, and we will be moving. We've already done a number of counties now around Mount Kenya region. We've already done Kiambu, we have done Murang'a, we have done Kirinyaga, we have done Embu, we have done Meru, we have done Nyandarua, and we will be going to other counties across the country to just ensure that people are getting the right information and at the right time. I have seen the other day a number of people who were hospitalized after taking food in an event. Please, let us ensure that food handling is taken with the highest level of hygiene. Let us ensure that the hygiene around our homes, in the hotels, in the restaurants, is at its highest. We do not want to hear people are being admitted in hospitals because of having eaten contaminated food. I am calling upon all veterinary officers and public health officers to ensure that the inspection takes place across the country. We want people to eat meat that is inspected. We want hoteliers and food handlers to have the certification, and equally to ensure that the food handlers are able to provide the highest level of hygiene in the vicinity and the facilities where they offer services. There are many issues to do with the over-the-counter medication, and we have also seen Pharmacy and Poisons Board, they have issued an alert around drug reaction. It would be important that if you are affected, that you report on the same. We are urging people to stop medicating or prescribing themselves over-the-counter medication, because this, if you're not a skilled workforce, or you're not a doctor, you're not a clinical officer, do not prescribe yourself.